My name is Patricia Nudi, the Executive Director of STADA. STADA focuses on health, specifically universal health coverage. And we know that universal health coverage requires a strong primary health care. So for us, particularly in this podcast, is to address what primary health care is and why we need to prioritize primary health care. So primary health care is primary for a reason. We can never achieve our health outcomes if we don't sort out the PHC part of our health care. And that involves, of course, universal health coverage, health security, and health and well-being in general. When you look at health and when you define health, it's not basically the absence of disease or infirmity. It is much more. It looks at the well-being of an individual. It looks at basic things that would trigger someone to get unwell. The very reason why someone gets unwell is because something has failed. And primary healthcare looks at how can we ensure that nothing sort of fails, or we minimize those failures so that our hospitals are able to cater to the people that are there, that the people that need to be there, and we need to prevent what needs to be prevented. And so when looking at primary health care, we look at issues of governance, issues of equity, issues of health security, and issues of prevention of diseases and promotion of health, and among others. And so looking at governance and equity, we need to look at who has been left farthest behind. As an organization, we really focus on people who have been left farthest behind because they are at risk of frequenting hospitals. They're at risk of their health failing. So these are pregnant mothers, these are children under 5. We have people who are predisposed to communicable diseases, and people who generally have their health at risk. When we look at issues around prevention of diseases and promotion of health, we look at water, sanitation, and hygiene, which is very critical in ensuring that we minimize the hospital visits. We look at nutrition, we look at family planning, immunization, attendance of antenatal care, among others. And as an organization, we have a hand on almost all of these things. How can we ensure that hand washing is mainstreamed? How can we ensure communities are better secure in terms of food security? Because you cannot talk about nutrition, for example, without addressing issues like food security. So we need to look at the social determinants of health. What is it that makes it easy for us to be healthy? What makes it difficult for us to be healthy? So looking at health in isolation is a fallacy. You can never address health in isolation. You have to look at issues of infrastructure. You need to look at issues of water, for example, issues of hygiene, and these are all components of health that are very critical in ensuring that we don't only have societies that are not going to hospital, but that will not go to hospital for a long while. And so in that, we recognize that there's the aspect of behavior change communication, but there's also aspect of advocacy. And in behavior change communication, really, it's looking at communities and being aware of the fact that no one will come to someone's house and open their windows. That is their own responsibility. No one will come and force you to wash your hands. That's your responsibility. How can we ensure that we give communities incentives to be able to look at health as something that is critical, something that is their responsibility to a large extent? Then the other aspect of primary healthcare that we look at is investments and financing. As much as we recognize that health is everyone's responsibility, the government bears the greatest responsibility because health is a right. And at the base of health is that recognition that health is a right, and we need to ensure that we treat health as something that is a responsibility for government, is a responsibility of county governments, national governments, investments. How can we ensure we have progressive policies? How can we ensure that we are having budgets? How can we ensure that leaders get it? Because that is the basis of everything. When we invest heavily in level 5 hospitals and don't invest in level 2, for example, sub-county hospitals, dispensary, what are we trying to say? Why are we constructing facilities that are not being used? Why are we continuing to construct facilities that don't have drugs, don't have equipment, don't have personnel? And why are we then making our level 5 hospitals or referral facilities to be congested, and then we don't have any work going on at the lower levels? And so the operationalization of primary healthcare as a whole requires that we first ensure that our primary healthcare facilities are functional. We don't need to go to a level 5 hospital for diarrhea treatment or malaria. We don't need to go to a level 5 hospital for information on family planning. It's unnecessary. How can we ensure that our community health volunteers are paid? How do we strengthen the family health system so that we prevent hospital visits? And even if we have hospital visits, then we are at the level where it makes sense. You can't queue a whole day for a treatment for malaria. Like, that should be as basic as your dispensary, your local dispensary. So government also needs to be held accountable. And so social accountability and looking at power really belonging to the people. How can we ensure that communities still get it? Because everything boils down to the community. It's the community to say enough is enough. It's the community to be able to advocate for some of these things. As civil society organizations, we come in to bridge that gap, but like, there should not be any gap. We should have communities that understand that they need to hold their leaders accountable. Communities that understand that health is is not only their responsibility, but then they are paying taxes and the power belongs to them. And so when a facility does not have equipment, what do? How can they be able to hold government accountable around that? So basically, as an organization, we work on all these areas, and we are partnering with like-minded organizations to ensure that we build consensus and movement building around some of these critical factors, so that we all come together and ensure that health for all becomes a reality. Because as we speak right now, it's more of a theory than it is practical, really. And I know government is making steps, I know communities are making steps, but we need to be able to rally together and really prioritize health. We should not lose mothers while they're giving lives. We should not lose children under 5 because they cannot have access to basic immunization services. We should not be able to treat cancer because basic nutrition services are like, people are basically overweight, and that is something that we can sort out. And so empower our community health volunteers, empower our health professionals, empower our communities, and hold government accountable to ensure that they do right by their societies, because people pay taxes to get services. Thank you.